Well, it's great to have you on the show. Kathy, maybe you could tell our guests a little bit about your background and why you're on Clean Talk today.
Sure. Well, I came into the infection prevention arena in 2003 when I was hired to become Chief Executive Officer of APIC, as you mentioned. And it was a really exciting time. My timing was really good because it was on the heels of the first SARS outbreak in 2002, 2003, which really woke us up around infectious diseases. And then MRSA became an issue. And then it was the whole alphabet soup of multi-drug resistant organisms. And we were finding that many healthcare associated infections were actually preventable. So that gave us a platform to really elevate the profession and protect patients. And so that was a very exciting time. Then I spent 5 years, I was recruited by Becton Dickinson and spent 5 years as Worldwide Vice President of Infection Prevention, which enabled me to do more of what I was doing on a global basis. And then I realized that where I had the most energy was around novel technologies. Those things that are not 510K products that are coming onto the market, have FDA approval, have some evidence that could really make a big difference in terms of preventing healthcare associated infections and protecting patients. But it's very hard for those technologies to gain a foothold in the marketplace. And so much of my work in infection prevention partners is helping those companies develop adequate evidence, help them educate around the problem and the technology, and find ways to accelerate adoption of those handful of novel things that could potentially make a huge difference. I also do some R&D work with these companies, and I've also continued to work internationally to try to advance infection prevention practice, mostly in developing countries.